So the adolescent and young adult group in Hodgkin's lymphoma is particularly complicated group of patients because we don't always know whether they should be better treated on adult studies or pediatric studies. They really fall into this category in between both, but they present some unique challenges as far as treatment outcomes as well as long-term follow-up. And particularly in the AYA group, there's a lot of long-term morbidities and toxicities and increasing toxicities as they get older, even decades after diagnosis. It becomes a really important group to focus on and think about what can we do to improve their outcomes overall, but while doing that, maintain better overall quality of life by minimizing toxicities. So our study really looked at using immune therapy in conjunction with standard chemotherapy treatments in order to improve the number of patients that were responding to therapy and decrease the amount of radiation that we would need to give to these adolescents and young adults. So we used a combination of both Brentuximab and the drug Rituximab to target both the Hodgkin-Reed-Sternberg cell as well as the tumor microenvironment surrounding this tumor cell, so that we could combine that with some less toxicity chemotherapy and maintain excellent overall outcomes and hopefully the goal to eliminate radiation altogether in these patients. So we were able to see that the combination of these things together in the adolescent and young adult group has led to 100% event-free survival, and more importantly, the elimination of radiation therapy in over 90% of the patients. So the median follow-up right now is about 4 years, but we want to continue to follow these patients even longer. The acute toxicities have been relatively minimal and well managed, and patients have been able to tolerate the therapy very well. What we're going to be looking at now is long-term toxicities, particularly cardiac toxicities, thyroid toxicities, other things that we see as these patients get older and older. We've seen a very few cases of severe grade 3 or 4 neuropathies, but we have seen some patients with lower grade neuropathies, which we're able to manage well during their treatment, and then we've noted that they've actually had complete resolution of their symptoms upon completing treatment. So fertility has always been a big concern with Hodgkin's lymphoma. We've been able to eliminate some of the more cytotoxic drugs such as Cytoxin, which contribute to infertility and other issues like that, and also our hope to be able to avoid radiation, particularly to the ovaries in young women. So we will have to follow this out longer as some of our patients reach that age where they're able starting to think about some of these fertility issues. But based on the data that's out there, we do feel that we are going to be able to minimize this.